home now.
Somehow it seems, not trying to get Pollyanna here, but whenever there is a problem, Chattanooga has a way of rising to meet the challenge. And I think that's the positive spin that we can put on an otherwise kind of overwhelming concern that we share as a nation this morning. I'm very happy to have Knox Farmer here. He is with CADAS. Next to him is Megan Revis, who is with the Hamilton County Health Department. And they are together the positive in this conversation about the opioid epidemic in our country. Good to see you both.
Thank you for having us.
You gave me kind of a 30-second history of the situation we're discussing this morning, Knox. Tell me if I've got it. We have this crisis in the country, navigators, people who can help someone walk through this journey and succeed,
Right.
are key to success. We had one in Chattanooga. Now, thanks to the Hamilton County Health Department, we have a total of 4.
That is correct. Probably this past year we've lost around 93,000 lives to this opioid epidemic. And so in the state of Tennessee, there have been in the past about 26 navigators that have been spread out throughout the state of Tennessee. In Hamilton County, we had 1 navigator, and so to cover Hamilton County and the surrounding 11 counties in the rural counties. With that, the Department of Health and the Hamilton County Health Department came together, and through a grant and through a partnership with the Department of Mental Health and Substance Abuse and CADAS, we were able to kind of add an additional 3 navigators for a total team of 4 to go out and really help those individuals.
Okay, what does that mean to be a navigator? What does that person do? Are they working just with the individual or the family?
So the navigator is a certified peer recovery specialist, so they have their licensure, and they're also individuals in long-term recovery. And so their role is to receive referrals from emergency departments in particular, because emergency departments really are a critical point of intervention for individuals with a substance use disorder. And so the navigators will receive a referral from the physician, and it's kind of a warm handoff, and the navigator will help link that patient to treatment and to community resources, and then also provide a 72-hour follow-up and a 30-day follow-up.
I know we talk, and rightly so, about what this past year has done for mental health in the country and the real rise in concern that we've seen with the opioid epidemic. Is it right, though, to say, Knox, that maybe there is some good that can also come from this year, because are maybe family members more aware now of what their loved one struggles to fight?
I think, this past year of dealing with substance abuse and such, I think the stigma, and we've been able to chip away at that a little bit more with education and understand that there's really not anyone out there that hasn't been affected by someone with a substance abuse disorder. It is a disease, and there is a cure for it. And so we're here just to let families know that, they're not alone. And even through this year of isolation, and we're sort of kind of coming out, but maybe not a little bit, there's resources here, there's help, and we actually have, additional navigators to help get those people that need help, really quickly.
Once you get educated about something, I don't care if it's math, you realize, how could I've ever not understood this before, right? It's so simple. This is anything but simple, but it's also anything but simple.
Right.
So for people who might think that, I'll just tell the person in my life, deal with it, or focus on the positive, or it's not that bad, all those kind of go-to cliche comments that we once upon a time made, it can't work that way.
No, it has come home to roost, and we have lost lives. And just to put it in perspective, Phyllis, who has been our navigator through CADAS, through the various grants, in the past year, she has seen about 246 individuals through the EDs and the emergency rooms. And that's 246 people that she was able to do a warm handoff and navigate them through treatment and save their lives.
Is there a profile anymore, Knox, or does this just really run the gamut? Does it hit young people more?
It hits every gamut. Young people, old people. There is no socio-economic platform that's exempt from this disease.
With these navigators, I know we talked about the opioid side of things, but there are many things that can hit people. So is it any kind of an addiction, or is it specific to opioid?
It's any type of substance use disorder, alcohol, opioid, stimulants. It really covers the entire gamut of substance use disorders. And I do have some numbers here. I'm a number person. So from July 2019 to June 2020, the Navigator program as a whole in Tennessee served 2,905 individuals.
Wow.
And 77% of those individuals were placed into treatment.
That's fantastic.
Which is amazing.
When y'all are talking about long term, what does that look like? Is that lifelong? Is that a year? What does it look like?
It can encompass halfway, or what I call transitional living. So you could have somebody that goes into medical detox, then to residential treatment, then to halfway house, which is maybe anywhere from 3 to 6 to 8 months. Mm-hmm. And then we also have sober living apartments, which are from a year to 2 years and out. But really, this disease is a lifelong battle that requires a lifelong treatment.
And it does require a lifelong education for, again, the family or friends who are walking alongside that person. So once the Navigator has placed somebody and helped them get into the right situation for them, does the family have some outreach that they can take advantage of too?
They do. There's various resource agencies that they can receive support on how to interact, and once they receive that loved one back into their lives again, from getting help, how to, boundaries and limitations and everything. So there is a lot of support for the family as well.
Okay, so if someone finds himself or herself in an emergency situation, they're going through one of our area hospitals, will this resource now be right there available for them, or do they have to request it?
It is available to them if they're in an ED or an emergency hospital. Right now we're working with probably about 18 of the area ED hospitals, and
what's
so they are
an ED
all
hospital?
Emergency department.
Oh, okay.
I would say ER, but but
okay.
ED, so emergency department. And so that staff is now being briefed as far as the Navigator resources, and so they know upon discharge, when they see somebody come in, they know to link them up with a Navigator one-on-one, so that they can begin that journey.
And if you've already left the emergency room, but maybe you're not having the help that you need, can you still access help?
Absolutely.
Do they contact you at CADAS or the health department?
They would contact the Navigator number, which is 423-643-1663.
Okay.
And that links them up with one of the 4 Navigators.
In the event that it's not on your screen, I want to read this back to you. 423-643-1663. If you're in an emergency room, they're going to help you with that if they feel that that's what you need. But if you're home and you missed this opportunity because it was a year ago or something, you can call.
Okay.
Do I have that right?
Yes, ma'am.
Okay. Thank you
Thank
both
you so
much.
Appreciate
Thank
it.
you.
Thank you.
If you've been involved in a wreck with a commercial vehicle, these cases are complex.